This is Local Edition. I'm Brad Pomerantz. Our guest is Dr. May Key. She is a dentist from the Los Angeles area who is doing everything she can to keep the mouths of young children healthy.
Exactly.
Tell us what you're doing, doctor, and thank you for joining us.
Sure, my pleasure. I'm glad to be here. Yes, I'm from an organization called HealthCare Volunteer, and it's basically a nonprofit organization free of service to the public for the basically underprivileged or poverty-stricken children to, basically needing screening, dental screening.
I have to tell you, I would not consider myself in that group, underprivileged.
Right.
That being said, my daughter, who is 4 years old, she has cavities.
Yeah,
so I can't even imagine with those who don't have intervention how it can be.
Exactly. You know, there's a new epidemic out there among children of age 5 and younger. The number one reason that there's school absences for that age group is due to dental caries, early childhood caries. And that's why we feel that with HealthCare Volunteer, it gives the public the ability to access a dentist that's willing to do this for them for free. And unlike the conventional way of screening, a dentist would come to the school and do the screening, the parents would not be there because the parents are outside of the school, at work, wherever they might be. And in this setting where the patient can come into the dentist that's in HealthCare Volunteer with the parents. And many, many benefits come from that.
I have to ask you, doctor,
yes.
I mean, it's a tough time now economically. Health insurance isn't paying as much. So why are you doing this?
Children has always been a part of my life. I have 2 young boys, which I love dearly. And also, it's a way of life for me, besides feeling good about being a good Samaritan. Also, as a little girl, when I was 8 years old, I escaped from a communist country and fleeing by a small ship. And when we were going to flee for our freedom, we're in the middle of the Pacific Ocean, and we were 4 days into the ocean, and we were running out of food, we were running out of water, running out of medication, and we were really in a desperate situation where our boat was even starting to leak in. And we saw a huge ship that was coming by near where we were at.
An American ship.
It was the U.S. Navy. It was the U.S. Navy that came in. They sailed to where we were at, docked, came down, fixed our leak, gave us food, medication, and steered us into the right direction to where we were going.
Which was?
Malaysia, the refugee camps.
I see.
And my father will never allow us to forget that day, and we will never forget that day.
So it's your way to give back?
Yeah, since then, it's my way of giving back. I'm sitting here today because of the U.S. Navy, and for that, I will be forever grateful.
So, since you want to give back so much, why don't you tell our viewers how they can take advantage of your services, if I may?
This is absolutely free to the children of 5 and under, the underprivileged children of low-income family. All they would have to do is log on to healthcarevolunteer.com/dental.
And it's not volunteers,
volunteer, singular.
Exactly, singular.
Okay, or they can call area code 310-928-3611 to access that care.
Well, since you're a dentist, and since I have young children, and many of our viewers do as well, give us a few tips. How do we keep our children's mouths healthy?
There's a lot of talk about sugar, how much sugar you could take. It really isn't about how much sugar you take, it's how frequent you're exposing that child's oral cavity to sugar. So basically, what you don't want is to have a child take apple juice in the morning, and then 2 hours later they're getting candy, and then 2 hours later they're getting more starchy carbs.
You bring up a good point, though. When you say the word sugar, many of us think candy bars, but there are also fruit sugars, milk sugars.
Exactly.
Explain that.
Fermented type of carbohydrates. And basically what it does is, you eat all this sugar and it stays around your teeth, and you're not able to brush that off, and you keep on doing this on a regular basis. That will basically cause early childhood caries and leads to many, many more problems.
Dr. Key, thank you so much for joining us. The website is healthcarevolunteer.org. For Local Edition, my name is Brad Pomerantz.